do this. So welcome back, everybody, to the weekly Holistic Actions webinars, where we help you put all of the symptoms of your pets into context and then interpret them holistically. I'm Dr. Jeff Feynman. Dr. Sarah Fox-Chapman is here today, and we have an esteemed presenter tonight that I will introduce in a minute. Basically, it's just a super duper honor for me to welcome a world-renowned internist, actually the head of internal medicine at Cornell University, vet specialist here in Stanford, Dr. Marnin Forman. Thank you, Dr. Forman, for being here with us. Dr. Forman graduated from Texas, I believe. Yeah, Texas A&M, you just told me. Then did his internship at Animal Medical Center in New York and got wooed over to UC Davis, the vet school over in California at UC Davis, to do a residency in internal medicine and fellowship in internal medicine. So he is incredibly well-versed in all of the best of both worlds, or best of one world, and we're here to take the one world and help put it in the more holistic context, because that's what we always really want you guys to do, is take all of the best information of the conventional world and then, decide what to do based on all the other information. So Dr. Forman, thank you again for being here, and take it away.
Well, hello, everyone. I'm so thrilled to be here. I was eager when Dr. Jeff approached me to talk to your group to do it. I always enjoy these sessions, and I think Dr. Jeff kind of gave me I think I'm blushing with the intro. I think it's a bit much, but thank you. I'm going to start by sharing my screen and hope this all goes okay. Dr. Jeff, the host disabled participant sharing screen. Do I need to be given permissions?
You do, and I forget every time. Sorry.
No problem.
You should be all set.
All right, let's see how this works. In one quick second, I'll fix that. Good thing we figured this out last night. All right. All right, so maybe if, Jeff, you can give me a thumbs up, am I good?
Looks great.
So, so this talk, what I was telling Jeff before, it's tricky for me because I've given talks before to different groups of non-veterinary groups, and some of the talks have been on like old dogs or cats, or there was this one men's group that I remember giving a talk to, but this one was tricky because it's on a disease process, right? And to some degree, when we start getting into disease processes, the way that I was trained, a lot of it gets into discussions of hormones and jargon and things of that sort. So I'm going to give this a try, and I'm very eager to hear you guys' feedback at the end of the talk, or you can boo during it if it's really going bad, but to give me your feedback on how it goes, all right? And the way that this is going to work is that there's definitely a lot of these slides that are going to be kind of higher level, but it's more just to give a taste of what is going on, and then hopefully I'll be able to explain it. And then if I run astray and I'm doing a bad job explaining it, or you have more questions, that's what the chat feature is for. And Jeff and others, and I think Sarah maybe too, are going to help me out from that point of view. So here's my kind of cutesy, can I have a little sugar in a glass of water? And we're going to talk about Cushing's, Addison's, and more. So when we talk about endocrine disorders, It's actually remarkable how complicated the body is and how many different, if you split them up into endocrine organs, there are. All right. Some of them we think about all the time. Some of them we may not think of. The thyroid gland is one of those ones where people think about because of the frequency of thyroid problems in people, thyroid problems in cats and in dogs. But then you have others like the adrenal gland, the pancreatic beta cells, so one part of the pancreas, the parathyroid gland, these little minutia glands that are right next to the thyroid that are super important in controlling calcium and phosphorus, the pituitary gland inside the brain, and then the ovaries and testes, which in a lot of our patients, they are neutered or spayed and they don't have those, and that endocrine gland is removed. And these glands produce tons of hormones, right? And we're not going to get into the hormones, and this list isn't even complete, right? But it produces tons of hormones, but you can test for these hormones. And a lot of the times we are testing for these hormones, and we're testing for them when we see certain collection of clinical signs that fit a pattern. All right. So for a lot of the diseases that you're seeing in blue on the right, doctors are trained to recognize patterns, right? And some of these diseases have really unique patterns that we see over and over again. And when we see that pattern, we start thinking about a disease. So how does that link to what we're going to talk about today? So this is how we're going to do it. For each case, there's going to be two different cases. I'm going to present the case to you almost like you were standing in a veterinary clinic and watching us work, right? Where you would see a doctor talking to a doctor, or maybe a doctor talking to a client, and then they collect information and then they go with it. And they start to try to figure out what's going on with the pet, right? So we talk about sigglement. This is how we describe a pet, a dog or a cat. Their age, what their neuter status might be, their breed, and then kind of what we call a capsule history. It's like the quick little elevator ride discussion on what's wrong with your pet, right? Not like the full drawn out every last detail, but kind of like, this is what I really am worried about with my pet. Can you figure it out? Then some quick little tests that we're going to do. We're going to do a physical exam and then some tests. And then we're going to dive into what we think might be going on at that point. All right. So here's Jessie. And I will tell you all the pets, that's actually their picture, but it's not their name. So I've changed all their names to kind of protect, the privacy of the pet owner. But these owners did give me permission to use these cases. So this is Jessie, an 8-year-old female spayed lab, right? And this owner came in and literally I went into the record and I kind of tried to pull out exactly what the owner said to us, right? And this owner said, I think my dog may have had a seizure. She's never had a problem like this before, all right? So we did what we call a quick PE. It's like our quick exam. We're looking at them and we're trying to figure out, can we look at that pet just with our eyes and figure out, did she have a seizure? Is she having a seizure now? Why did she have a seizure? So when we looked at her, and I will say this didn't come in to see me, it came in to see another doctor. They took her temperature, it was normal. They checked her heart rate, and this is an 8-year-old lab, and the heart rate's 120 beats per minute, BPM. That's kind of quick for a lab. They usually have slower heart rates than that. And then the RR, that's respiratory rate, how fast they're breathing. And this lab was breathing quite quickly at 60 breaths per minute, but not strikingly. It wasn't like having a hard time breathing, just quicker than normal. So then we looked at the gums to see if the gums looked abnormal, and they were pink, just like they should be, and they were moist, hydrated. And then we did what we call a CRT, a capillary refill time, and it was just like we would expect, 1.5 seconds. So when we looked at the pet, there's really nothing striking on the exam, and it wasn't seizuring when we were seeing it. So this doctor decided to place a catheter, and then did what we call StatLytes. So StatLytes is a blood test. So I'm putting up the blood tests now, and they're just a mixture of numbers, right? But what I will tell you is that there's one number that really stands out, and that's that GLU. I don't know if you can see the G, it looks blurry to my eyes. GLU, which is glucose. And a dog's glucose should be definitely above 60. Really, it's usually between 80 and 120. So that's a really low glucose. And when you have glucose that low, a pet can have a seizure, right? So this doctor, and when they took this case, they were like, all right, I have a good sense of what's going on with this pet, all right? If you have your eagle eyes there, you can also see that, this happened in 2011. So admittedly, this was a little bit ago, but it's still valid even now. So marked hypoglycemia, marked really low blood sugar, all right? So now as a doctor, we're thinking, well, wait a second, what should I do, all right? Should I recheck that blood sugar? Because maybe it's just wrong. Maybe the test is wrong. Should I get more history from the owner? Because maybe the owner will tell us that this pet is a diabetic and is on insulin and maybe got too much insulin by accident or got insulin when the pet didn't eat well. We could treat it for low blood sugar by giving it something IV. We have that IV catheter in place. Or maybe we could just give it a meal, right? After we eat, the blood sugar goes up really quite quickly. We could give it steroids, which is a common treatment that we would use for low blood sugar. Or we could give it a drug called glucagon. Considering the number of people in this audience is probably at least a couple of people that are diabetics, just statistically. And if you're a diabetic, you know that glucagon is a rescue drug to increase your blood sugar. But why did this dog have this, right? Well, there's a couple of things. So one is that it could have eaten something that causes blood sugar to drop, all right? So xylitol, it's known to do this. So xylitol is a sugar substitute. It's in Orbit gum. It's actually in lots of other things now too. And xylitol can cause a really marked drop in blood sugar. Insulin can do this, right? But usually the owners are going to give us a hint. They're going to say, my dog's a diabetic, right? But every once in a while, weird things happen. Then there's rare things like a lot of aspirin. If you give too much aspirin to your pet, it can do it, or ethylene glycol, antifreeze. These are uncommon. Cancers can really do this. And when a cancer causes low blood sugar, they call that paraneoplastic. But then endocrine problems can do this. Addison's disease, hypothyroidism occasionally can do it, or even what they call hypopituitarism. So a problem like a dwarf. And then there's other things that can do this too, like severe infections or pancreatitis, or when you work a dog so hard, their blood sugars go down, all right? And this is something that we don't see here. When I was in Texas, every once in a while you would see this. They would have these dogs that they just love to work and work and work, and their blood sugars would get so low and then they would get sick. So what we decided to do was go back and talk to the owner a little bit more. And what she told me was that there was an acute onset of really marked weakness, and then the pet had a seizure. But in hindsight, she's been weak for 3 weeks, and she had gone to her veterinarian initially 2 weeks ago and said, you know what, my dog's rear legs are really weak. And they did a testing for Lyme disease or Ehrlichia, anaplasma, these different tick-borne diseases that can cause this, and it was all negative. And then this was a hint. The dog ate better than normal, was super hungry. All right, that was a hint for us on what this might be. So here we are in a physical exam. This is a video. Let me see. I don't know if this is really that impressive, but let me show you. No, I'm not going to show you. I'm going to try again. So what I'm trying to show, it's a bit short. I think that the assistant got more tired than she did, but she was pretty tired, right? And this was normally like a robust like lab that could really go for long walks, right? And she was just tired, and it was hard for her to get moving. And she was what we call a dull mentation. So then we did some standard testing. And for the most part, it really didn't help us. Her blood pressure was normal. Her red blood cells were normal. Some people in the audience might be thinking, well, maybe she's anemic, all right? Her biochemical panel was normal, except for that low blood sugar. We checked it again and it was still low, and she had no evidence of an infection. So we took a chest x-ray, looked totally normal. So at this point, I'm actually curious if anyone in the audience is willing to unmute themselves and say, I think it's X. I will say it's hard to unmute yourself, especially when there's, I don't know, 46 people, I think I saw at one point. And who wants to really, you probably don't know each other, so I get that completely. What I will tell you is that if someone came out and said, I know what it is, I'd be impressed, right? Because I didn't know what it was at this point, right? I had a better sense of what it wasn't, right? I didn't think it was anything that was given to the dog. It wasn't insulin. It wasn't xylitol. This dog was an active dog, but it wasn't a hunting dog. It wasn't a sick dog like pancreatitis, and I could probably have even taken off some of these other diseases that we see with sickness, all right? I was wondering about Addison's disease. So what can be done now? Well, we can do more testing, right? We could test for Addison's disease. We could test for thyroid problems. Thyroid problems don't usually cause a low blood sugar, but they can. We could do an ultrasound to look in the belly, or we could look at the liver, or we could look for a disease of the beta cells. So if you remember at that second slide, another one of those endocrine organs is the beta cells of the pancreas. So how about Addison's, right? So there's different types of Addison's disease. There's classic, or what we call typical, and atypical. So typical is more common. That's nice, all right? So at least the veterinarians were paying attention to name that one. So the typical one is when they have a decrease of two hormones, cortisol and mineralocorticoid, the one that controls salt and sugar, all right, salt and potassium. The atypical is when the sodium, the salt, and the potassium is normal, but they only have a deficiency in steroids, cortisol, all right? So if you look at the studies, the atypical are more common in females. This is a female, all right? The atypicals are usually older at diagnosis or really young, all right? So there's some things that kind of fit the pattern with this one. I will say that at 12, I think she was 12, she's a little bit too old, if that makes sense, for Addison's disease, but I thought about it. And there's different ways that you can test for Addison's disease. You can do a quick test, or you can do a full test. So the other ways you can test for Addison's disease or some of these other things is with imaging, all right? And some of you probably have had imaging done of your pets or even of yourselves. You can have an ultrasound or a CT, and there's pluses and minuses for each one. So I hope I'm building up some suspense, right? This is, it's not as good as Netflix, but I'm hoping that there's some suspense in the audience, that that you guys are in your mind, you're saying, I think it's Addison's. Or maybe you're thinking, I don't think it's Addison's, even though this talk is on Addison's. I think it's going to be cancer or insulinoma. So we did an ultrasound, and for the most part, it didn't help us. All right, it saw one enlarged lymph node. But if you look at the left side of the screen, the cortisol was 7. So if it's above 2, it rules out Addison's disease. So this dog didn't have Addison's. So then we did that insulin to glucose ratio, and that was the problem. This dog's body was making way more insulin than it ever should. And it was because it had a cancer of its beta cells, its little tiny cells inside the pancreas. And that's what his problem was, her problem was. So how do we treat this? Well, there's different ways you can treat it, but dietary therapy is really important, right? Which is another reason why I thought this was a good one to talk about. We can give high protein, low carbohydrate, simple carbohydrate diets, right? We really, even though their blood sugar is low, we really don't want to just give them sugars, right? Because what happens is that the sugar will go up, it comes down, it goes up, it comes down, all right? We also don't, if we can, don't want to give it IV sugar. And some people are surprised by this. They'll say, well, wait a second, my dog's blood sugar is so low, you must want to give it IV sugar. But the same thing happens. The sugar goes up, then that cancer of its pancreas reacts to it and releases even more insulin. There are medications that we can give. And again, as Dr. Jeff kind of did the lead in, my approach is with, I was trained to give drugs like prednisone, dioxide. I'm sure there's other drugs that maybe Jeff would want to speak about that he would consider, all right? And then there's chemotherapy or things of that sort. You can do surgery. Oh, sorry, guys, I forgot. My wife would have slapped my hand if she saw this picture when I was giving a talk to a general audience. So I'm sorry if I just grossed anyone else out. I saw someone shaking her head. I wasn't sure what that meant. But you can do surgery to remove it, right? Or you can just treat it with medicines and diet, right? And this is one of those weird cancers that sometimes, even when we give it with diet and medicines, the MST, median survival time, can sometimes be quite long. That median survival time in one study was 196 days. But if you look at the range went up to years. So for Jesse, the owners decided to not go to surgery. They initially were considering it, but they ultimately elected not to. And we treated Jesse, and I think I know we're not still treating Jessie, considering how long ago I saw this pet. I don't know how long she lived, but she lived for quite some time with dietary therapy and low-dose prednisone. So one quick second. Okay, before I go on to the next one, I don't know if I should open up for quick questions now, Jeff, or should I go right into my next one?
Why don't we go right into your next one if unless you want to raise any other discussion. Okay.
So I will say, guys, I'm going to try to finish a little early to leave some times for any questions. I know we're an hour slot. So from 8 to 9, I'll try to stick to that as tightly as I can. So I'm going to try to finish this maybe around 8:45 or so, this next one, maybe a little bit earlier, and then leave a little time for questions. So here's Lucy. Lucy, that's Lucy's picture. She's an adorable little dachshund. I will say I'm a dachshund fan. I currently don't have any dachshunds because my wife doesn't want a dog right now because we have children. I said they're not interchangeable. I used to own dachshunds, and I have dachshund figurines and collections with my daughters. So this 12-year-old dachshund, female dachshund, the owner came in, she says, my dog must have diabetes mellitus, right? So there's different types of diabetes, but most people, when they use the word diabetes, they mean sugar diabetes. She's drinking so much. So the doctor took her in and did a quick look at her. And they said, all right, her temperature it's okay. It's like the high end of normal, 102. Normal for a dog is up to 102.5. Her heart rate for a dachshund, 90 is okay. And she was panting. All right. So 80 breaths per minute, but she was just panting. All right. And she was quiet, but she was fine. Her capillary refill time was 1 second, totally fine. So they didn't place an IV catheter. They're like, oh, okay, maybe she just has diabetes, right? Sugar diabetes. So they did that same test that they did on the last pet. And here it is. So they did that. Now with a diabetic, we'd expect their blood sugar to be high, right? And oftentimes when we diagnose diabetes in veterinary medicine, right, the blood sugars are significantly high, like 300s, 400s, sometimes 500s, all right? If you have a mildly elevated blood sugar, we sometimes don't focus on that as much as they would with you and I, because dogs can be nervous at the time of their blood draw. I guess we can too, all right? But her blood sugar was totally normal, all right? And also other things were normal. Her sodium was normal. Her potassium was normal, all right? Really, all the quick tests were totally normal. So what could be done quickly now? She has a normal blood glucose level. I thought she was a diabetic. And I will suggest that I've had a number of clients say to me, I think my pet has X disease, and they're right. I'm curious if the veterinarians in the group have had that same experience. And sometimes the pet, I wouldn't have thought of checking that pet for that disease, but the owner had a sense, and oftentimes they're right. In this case, at least the initial testing doesn't seem that way. I guess we could recheck the blood glucose just to make sure it's real, that it's not falsely low. We could get some more history. Would we give this pet insulin? I don't know if I want to give pet insulin if their blood sugar was normal. We can measure an insulin level. We can do that. We could measure at home urine glucose levels or blood. So we talked with mom, and actually, I think this was dad. And they said that that Lucy has been drinking a ton, peeing a ton, so polydipsia, polyuria, and waking up in the middle of the night to pee, what we call nocturia, and having urinary accidents. And it has been going on for months, all right? She's also gaining weight, even though they're trying to diet her, right? So they're giving her less calories, but she's gaining weight. She's panting. She's weak. She's losing hair, all right? But she's not vomiting or having diarrhea. And importantly, she's not getting any medications that might cause these signs, all right? And I'm going to circle back to that soon. So this is a picture of Lucy up here, and has a very particular type of hair loss that we look for in dogs that might have Cushing's disease, all right? It's called truncal alopecia. So their trunk, their midsection, they start losing hair right there. And she had this very particular type of appearance, all right? The picture down in the middle there is not Lucy, but they can also get other issues where they get stretching of their skin, which is called striae, or they can get these weird bruising where the blood vessels of their skin kind of break open and they bleed a little tiny bit. So she really, to be honest, looked like a dog with Cushing's disease. There's other things that we sometimes can pick up. Their livers feel enlarged, right? Or they can deposit fat right around their trunk, right around their hump, their rump, their back end, all right? So what's going on with Lucy? Well, to be fair, I really thought she had Cushing's, all right? But maybe she has diabetes. This is not apparent. But to be fair, we want to be careful whenever we're diagnosing pets that we don't have the blinders on. And we have to do this as doctors, just as you have to do it with your own pets, where you sometimes will Google a disease process and you're like, that's it. That's what my pet has. But then once the testing comes out and you're like, oh, my pet doesn't have that, but it's hard to kind of switch away from it if you didn't at the beginning keep an open mind. So other things that can do this, thyroid problems can do this, liver disease, hypercalcemia, elevated calcium. Fluid accumulating in the belly can do this. And that's actually one of the things that sometimes really fools us is fluid accumulating in the belly. Infections can do this, like pyelonephritis, which is a kidney infection. Or you can have a different type of diabetes called diabetes insipidus. So this is water diabetes. This is when dogs or people are super duper thirsty, right? And there's different reasons why they get it, but they can't concentrate their urine well. So they always are peeing. And because they're always peeing, they always feel a little bit dehydrated. So they always want to drink. And in dogs, sometimes when they get this, they drink so much that they rather drink than eat, right? And some of these pets will actually lose weight. There's a different disease that really has a crappy name, but it's called psychogenic polydipsia. So this is when dogs drink more water than they should. And we say psychogenic from the point of view that it's not due to a disease process like we talked about above, but it's something mentally that's driving them. And sometimes this can be dogs that are really high energy, that are given a high energy diet that aren't exercised enough or something like that. So here's Lucy. So we did some testing, and a lot of her testing sure did look like Cushing's disease. So we did some initial testing.
701, triage for canine 701.
She had mildly high blood pressure at 170. And that's actually relatively common in dogs with Cushing's disease. They usually don't get high blood pressure, but it's mildly high. They can have abnormalities on their complete blood count, the CBC, where the lymphocytes are low and the platelets are high. They can have a biochemical panel abnormalities. And here's what's interesting. When we sent out the biochemical panel for Lucy, her glucose was mildly elevated, but just mild, all right? And she didn't have any glucose in her urine, so we still didn't think that she had diabetes. She had elevated liver enzymes. She also had a urinary tract infection. And a lot of people are a little bit surprised by that when we diagnose a pet with Cushing's disease. A lot of them have urinary tract infections. And they'll be surprised. They'll say, well, my pet didn't show me signs of a urinary tract infection. And sometimes those signs are really obvious, like they'll pee and it'll smell bad, or it'll look bad or look abnormal. But sometimes it's more subtle, right? Like accidents in the house or peeing in the middle of the night, things that Lucy was doing. To complicate it even more, dogs with Cushing's disease sometimes won't show evidence of a urinary tract infection because the disease of Cushing's disease is too much steroids. The body is making too much steroids, and those steroids decrease the inflammation in the bladder and kind of hide some of the signs of a urinary tract infection. So there's different ways of testing for Cushing's disease, and I really didn't want to get too down deep in the Cushing's disease discussion, but as a general statement, one second, I just want to look at the next slide. Yeah. There's different ways of testing, all right? There's a short test and a long test. The short test is nice and easy and short, all right? And that's the one ultimately that was done in this case, an ACTH stimulation test, and her test was consistent with Cushing's. The long test has some benefits. And one of the big benefits is that with the long test is that it can look for different types of Cushing's disease. So big picture, there's different types of Cushing's disease. There's a brain type and adrenal type, or belly type. The brain type is usually due to a growth inside the brain, deep inside the brain. And sorry to gross you out even more with another picture. But what we're looking at is a picture of a pet's brain. He's passed on. And this is a slice through his brain. And what we're looking at is this dog had Cushing's disease, and he had pituitary-dependent hypoadrenal corticism due to a growth in the pituitary gland. And this dog had a big growth, all right? This is what we call a pituitary macrotumor or macroadenoma. Most pets don't have a big growth like this. They have a tiny growth in their pituitary gland. You can see it if you do advanced imaging like a CT or an MRI. So the most common type in small dogs is the pituitary-dependent. And medium to large dogs, it's about 50-50. About 50% of them will have the pituitary type, the brain type. The other 50% will have the adrenal type. So therapy. There are so many therapies for Cushing's disease. All right. And there are therapies that have been looked at in the veterinary profession. There are tons of therapies that have been tried for dogs with Cushing's disease. My training was at UC Davis, like Jeff said, and I trained with two doctors who have done a lot of the groundbreaking research on Cushing's disease, although to be fair, it was 20 years ago. And they looked at a lot of these different drugs. And what they found is that all of these drugs have pros and cons, all right? The drug that's used most commonly is at the bottom there, which is called trilostane or Adrenal. That is an FDA approved drug. So that drug has gone through FDA approval. And it has been shown to very effectively treat dogs with Cushing's disease. But like all of these diseases, or all of these treatments, they have pluses and minuses. I will say that if with adrenal Cushing's, one that I really didn't focus on much at all, but that picture, what you're looking at here, I don't know, do you see my mouse? Can you see my mouse? You can, great. So right here is a mass, right? So what we're looking at is we're deep inside the belly of a dog, right? This metal thing right here is what the surgeons use to kind of open up the belly. And this is a mass, and the surgeons are going just about to remove it. And removing it cures Cushing's disease. So it has a big advantage there, right? But it's also a surgery. So Lucy was started on Lysogen, and part of this was because this is so many years ago. Lysogen is a drug that is very effective, but again, has its pros and cons. She actually did great on it. She was losing weight. She was much less drinking and peeing. She could hold her pee all night long. She was just a more happy-go-lucky dog. The one thing that the owner said is that she still eats like crazy. That's the polyphagia. And I don't know if that's because she's a dachshund and she just wanted to eat, or whether a different reason. So that's it. That's a picture of my daughter many years ago. And I'm going to open up the field for questions or whatever Jeff feels is right next.
Marnin, that was amazing as always. And if you could unshare your screen, that way we can all come back together and answer any questions. So there was a lot of stuff in the chat. Anyone want to unmute and ask? Oh gosh, that's a bunch of member questions. It'd be awesome if somebody wants to see anything.
And I can try if we want to kind of look through here and try to pick out some questions. I don't know if that would help or not. I see a question about surgery. So the question is, surgery is considered very risky. UF surgeons, University of Florida maybe, steered me away from it, but my friend's dog just had it done and it was doing great. So the question about surgery is that it has risks. There is no question about that. A surgeon that's really good at that type of surgery, they oftentimes will do well, but it is not without risk. And the risk goes up much higher if the mass is really big or grown in blood vessels. And a lot of owners, even if surgery is an option, they just choose that that's not right for them, right? It's okay. It's not something that, even if we diagnose an adrenal mass, some owners elect not to do surgery.
And there's a bunch of questions on prevention. Do you have any thoughts on if Cushing's can be prevented?
So there's a couple of ways of looking at this. So there's one type of Cushing's disease, and I meant to circle back to this and I didn't. So if a dog is getting steroids, and if they're getting a higher dose of steroids, they're going to form signs like Cushing's disease. It's not what we term endogenous Cushing's. It's not because of a problem inside the body. It's because we're giving a drug that's causing those same type of signs. So reducing that drug if you can, stopping that drug if it's safe to do so. The challenging thing is, at least for the patients that I see, we sometimes get into situations where we have to give them drugs, or we feel like we have to give them drugs to control their disease, and then they develop side effects like Cushing's disease. That's one. That there is some thoughts that Cushing's disease might be genetic, all right? And this is something that up at Cornell University, we're looking at. We have a very large genetic bank that we're trying to look at different diseases to try to determine if there's a genetic mechanism for it. Now, this is not something that's going to happen today, tomorrow, 10 years from now. But Jeff is laughing. I'll probably be well retired before we ever figure this out. But the hopes is that at some point we could identify if maybe certain breeds of dogs have genetic markers for Cushing's disease. And if a breeder elects, they will not breed that type, right? But that's far down the line. What causes Cushing's disease? The vast majority of the time, we don't know. We think of it as a cancer from the point of view that it is in a proliferation of tissue, either of the pituitary gland or the adrenal gland. And really, the reason why we recognize it as a syndrome, this Cushing syndrome, is because it makes this hormone, right? And that hormone causes classic signs.
And there was great question about using the urinary, about what you think, first of all, of the urinary cortisol creatinine ratio for screening Cushing's.
So it's actually a very, very effective test for classic Cushing's disease. And I saw atypical there, and I'm going to go into that a little bit too. But for classic Cushing's disease, this one test, which is called the urine cortisol to creatinine ratio, UCC. So what it is you collect a urine sample, ideally when the pet is not stressed at all, maybe even at home, all right? It's better to do it that way rather than to even bring them into a veterinary clinic. They get a little bit nervous on the ride. Maybe they get a little bit nervous in the waiting room, back when we used to have waiting rooms where clients would wait. And then they can falsely affect this test. But the urine cortisol creatinine ratio, if that test is negative, right, the likelihood of Cushing's disease is very low. But the drawback of that test is when it's positive, it really doesn't help us that much, right? Because there's so many other scenarios that can cause a positive urine cortisol creatinine ratio, including just being super sick, right? If you have a pet that's really sick, like vomiting, diarrhea, has diabetes, has pancreatitis, has liver problems, they can have a positive urine cortisol creatinine ratio. So one D0 is atypical Cushing's disease considered here as a differential. So I mentioned that with Cushing's disease, you have two types. You have a brain type and a belly type, pituitary-dependent, adrenal-dependent. But that's a little bit of a misnomer. There's even a different kind of spectrum to look at. You have classic Cushing's disease or atypical Cushing's disease. So classic Cushing's disease is an excess of one hormone, cortisol. Atypical Cushing's disease is an excess of many different hormones, potentially, including something called 17-hydroxyprogesterone or other types of hormones like it. That test, atypical Cushing's disease, there's only one lab that usually does most of that. So people know it as the Tennessee test, the University of Tennessee test. And some people might be familiar with that. That test is looked for, classically, we only look for atypical Cushing's if the pet doesn't have typical Cushing's. So we start the process by looking for typical. either with the 1 hour test or the 8 hour test. And then if we still think it's Cushing's, even though the 1 hour test or the 8 hour test is negative, then we might look for the atypical. So I think this is a comment, but I'm just kind of going in. And my dog was on trilostane, made him so sick, so I decided not to give it to him anymore. We'll try something more holistic, natural. And if anyone wants to jump out,
yeah, I'll actually.
Hello,
there's like,
I'll actually jump in there because lifestyle and homeopathy and other changes that affect the underlying cause for the Cushing's in the first place can be real effective in some pets, but it depends on the context, the full context, of the situation. If it's an adrenal tumor, probably not as much as if it's a pituitary-dependent Cushing's. So, but that's a good place to consider a complementary or integrative therapies, and that is when when the drugs like the trilostane are causing a problem or triggering a problem, because they're not actually causing the problem.
the other thing about Cushing's disease is that Cushing's disease is one of those conditions that's very chronic. These pets usually don't get Cushing's disease quickly. And in some dogs with Cushing's disease, they really don't have bad signs, right? Some do, right? But some of them, it's more of a kind of people are wanting to know kind of what's causing the problem. But once they hit that point of knowing what it is, they debate, do I want to try something that is like trilostane or one of the other drugs, or potentially something like Dr. Jeff is mentioning, like a homeopathic approach? And the nice thing about Cushing's disease is that it's not something that typically, if it's not treated in either approach very aggressively, the pets will go on and be very sick. All right. There's exceptions, right? Some dogs, they really have severe signs of Cushing's disease, like Lucy, who, some owners, it just drives them crazy, all the drinking and peeing and the hair loss and things like that. And sometimes those infections, like that urinary tract infection, can cause bigger issues, either recurrent infections or maybe a kidney infection.
So you're saying, in your experience, that most of the dogs with low grade or manageable Cushing's will go on to progress to more severe disease, or that they can have severe consequences like thrombi or.
So yeah, so I don't want to say left untreated. Classically, if you look at the vast majority of dogs with Cushing's disease, their signs will get worse. It doesn't get worse usually like overnight or quickly, but it'll slowly get worse. But the complication rates, like urinary tract infections, or you mentioned blood clots, thrombi, those aren't common, but some of those complications are really severe if they happen. And the one that you just mentioned, blood clots or thrombi, these dogs, we believe, have higher rates of thromboembolic disease, blood clots to their lungs, or blood clots to the brain causing a stroke, blood clots to their legs. These are not super common by any means, but if they happen, it can cause very severe signs, rarely death. So it's one of those scenarios, it's a ratio or a statistics scenario of, it's an uncommon risk, but if it happens to your dog, especially if it's a severe complication, it's a big deal.
Great. So yeah, that's a great rule for everyone. It's all a risk benefit ratio, no matter what you decide to do. And so knowing what the risks are, like somebody asked about, not giving conventional meds to an Addisonian, And that's a way more risky than doing the same for cushingoid for the most part.
Yeah. So yeah, that's a really good example. So Addison's disease, and it might be even be good to draw a direct line between the two. So Addison's disease is literally the opposite of Cushing's disease. So Cushing's disease, too much cortisol, Addison's disease, too little. All right. And left untreated, it is fatal. All right. Early on, when they were discovering Addison's disease, everyone died from Addison's disease. And then they discovered steroids and they started to survive. And so, you know, what I would suggest with Addison's disease is don't stop therapy with steroids if your pet's well controlled. If by chance your pet has Addison's disease and is showing side effects from the steroids, like drinking a lot or peeing too a lot, that's often just a dose issue where you just have to modify the dose.
And a great question about use of ketoconazole for Cushing's.
So ketoconazole was looked at back in, I want to say it was like the 1990s or so. And the dose of ketoconazole that they would need to control Cushing's disease usually caused an upset stomach. You can control it with ketoconazole, but you had to give it a good amount. And usually those pets had an upset stomach. And with the development of the newer drugs, in particular trilostane, I haven't treated a dog with ketoconazole or even heard of a dog treated in years and years, probably over 15 years. So I don't know if the person who asked that, is their dog being treated with ketoconazole for it?
Don't know. LW, do you want to come in the chat if your dog is being treated? A couple of other great questions. One is your opinion about steroid eye drops and systemic effects of steroids.
So as a general comment, there is not a lot of systemic effects from it, but there is some, all right? So there is some absorption. The absorption is probably higher when there's really bad eye problems, right? So if the cornea is very abnormal and there's a lot of blood vessels, it can absorb more of those steroids. If the steroids are given more frequently, but they have done studies that suggest to affect the adrenal glands.
Awesome. And question about the alk-phos SAP numbers, about where would you begin to worry versus, treating lifestyle and I guess it says it's right now SAP is at 203, ALP is at 203. Do the numbers of the alkaline phosphatase affect your treatment decisions?
Not typically. I mean, by all means, if they're really elevated, I'll pay a lot more attention to it. So if the alk-phos is, over 2,000 or 3,000, like really high alk-phos, but for the most part, when looking at liver enzymes, I'm just looking at the underlying cause and then treating that cause. All right. So if the underlying cause of the elevation of alkaline phosphatase is a gallbladder problem or Cushing's disease or a liver cancer, right, to treat that cause versus just treating the number.
And I'm sorry for this, but a total endocrine geek question. Does any lab, do you know, Marnin, run SAP isoenzymes anymore?
I think, have you asked me this question before? I think you, I think I went down that rabbit hole before. And I want to say when I went down this rabbit hole last time, I thought it was Texas A&M, the GI lab. It might be.
The reason I asked everyone is just because Dr. Forman mentioned alkaline phosphatase liver problem possibility, and but liver isn't the only source for SAP, ALP, and the isoenzymes just will at least choose to key in on where it was coming from. And we only have a few minutes left, a lot of questions. Someone asked, how does phenobarb affect a dog with Cushing's?
So phenobarbital is tricky because some of the signs of a dog that a pet getting phenobarbital will overlap with signs of Cushing's disease. It causes them to drink a lot, pee a lot, they gain weight. They can also have elevated liver enzymes. It affects the metabolism of drugs, the phenobarbital. So it makes it trickier to figure out if a pet has Cushing's disease. But from a testing point of view, you can still go through the testing for Cushing's disease.
And follow up on the ketoconazole, not being treated currently with ketoconazole, but she was wondering about, a drug that would allow less monitoring than the federal does right now at this point.
Got it. So the ketoconazole, they still monitor those pets, if I remember correctly, the same pattern as Lysodrine. So it was still a pretty frequent monitoring. If I was looking for a drug that was less than Lysodrine, did you say less than Lysodrine?
She was,
Or
I
Adrenal?
think, Adrenal.
Adrenal, okay. You can try low dose Lysodrine. It's just not the. It depends on the case, and like how bad the Cushing's disease is. But if you're going with low dose Lysodrine, you could probably get away with less monitoring.
Okay. And
Well, I don't know if we're coming to an end.
we are, and there are lots of thanks and LWS just again about essential resource center. I guess a resource should recommend for vets that aren't familiar with Cushing's.
A research
Resource, like Finn or other resource.
Oh, like a textbook, you mean?
I guess.
The textbook, I'm seeing if I have it above me right now. The one that I think is fantastic is by Nelson and Feldman, the endocrinology textbook. Yeah, I don't have it.
Who you knew
have it with me
UC
right now.
Davis.
But yes, I know I'm a little bit homegrown there, but I think that that's a fantastic reference. So.
And I think her question was about just state-of-the-art treatments. So they keep that updated. And
Yeah, they've actually, I think they're rolling out another one soon even. So yeah.
Yep. All right, so just more thank yous, and Dr. Forman, I cannot thank you enough. And tell us that was awesome. Just, you're getting lots of bravos, and thank you. And we hope see you all soon. And Dr. Forman, hope we see you in 2022. And next week, guys, is our Q&A, member Q&A. So if you have any Cushing's, Addison's, or any endocrine questions, because October is our endocrine month, bring them for next week. And then the week after will be pancreas, stuff with the pancreas, and or actually, no, I'm sorry. The week after that is glyphosate, and Dr. Forman, we didn't even get to talk about endocrine disruptors in the environment, like Roundup and other potential toxins.
So much to talk about.
Definitely. So thank you again, and that was
You're welcome.
Fantastic, and we'll see you all soon.
Bye-bye, everyone.
Bye. Thank you.